DJing us. Good morning and welcome to the Coalition's July 20th membership meeting. We forgot to change the date on that slide, so just ignore that, June 15th. It's actually July, it's July 20th. And welcome to the Seattle King County Coalition on Homelessness General Membership Meeting for the month. Thanks, Rachel, for bringing us in with the sounds of the Moondoggies from up in Bellingham. Thanks to everyone for joining us this morning, for introducing yourselves in the chat to one another, and for being on camera if you're comfortable doing so. We are going to review the agenda briefly with you. And heads up, we're going to invite someone, and I'm going to invite a service provider this morning to think about reading our mission, vision, and values just after we review the agenda with you. That's how we like to start every meeting, as a way to ground ourselves in who we are and what we're doing together. I am really pleased to say that this morning, after some quick updates related to our upcoming August 1st primary election, less than 2 weeks from today, which you will hear more about from Jody and Tim in a moment, we're going to talk about two pretty important issues. One is the fact that the public health emergency related to COVID-19 is officially ending in a variety of ways. And what that means, among other things, is that many people who are receiving Medicare or Medicaid benefits are going to need to be re-qualified for those benefits. And that means that they're going to need to respond to a request for recertification information. We want to make sure that people experiencing homelessness, who of course have a lot of barriers to receiving care in the first place, are not among the estimated 300,000 Washington residents who, pardon me, forgot to turn my phone off, who might be at risk of losing their public benefits. So we have terrific folks here from the Northwest Health Law Advocates and Solid Grounds Public Benefits Project to talk with us about that. And then we're going to talk about crisis behavioral health response services, both the services that currently exist, which we all know are very limited and not adequate to meet the needs in our community, and the potential through the Crisis Care Centers levy that voters passed in April for bolstering those services. And we're really pleased to have the person in charge of the implementation plan for the Crisis Care Centers levy, Kate Baber, whom you might recognize as a former coalition member and board member, joining us. Rachel, can I ask you to put the slide for our mission, vision, values up? Thank you. So that's going to be the bulk of our meeting. We will have a little bit of time at the end for member announcements. So please, if you want to send Tim or Jody a message, make sure we get you on the list for making a member announcement. That would be great. Oh, so sorry that you're having trouble seeing the slides. Please do leave and come back. Is there someone who can see the slides who would like to indicate their desire to read our mission, vision, and values? And I'm going to ask my colleagues to help me because I can't see everybody. But if you would like to raise your hand. Great, Brianna, thank you. Would you be interested in unmuting yourself to read them?
The mission is we mobilize our community to challenge systemic causes of homelessness and advocate for housing justice. Vision is a region that acts on shared sense of responsibility to ensure that everyone has a home. Values, equity, justice, collective action.
Thank you very much, Brianna. Wonderful. Well, good morning once again. And I will now hand things off to Jody Rao, our Senior Programs Manager, and Tim Marshall, our Member Services Coordinator.
Morning, folks. It's lovely to see you all. I'm glad you're here with us. So as Allison mentioned, Tuesday, August 1st is the primary election. And as we all know, primary elections tend to get ignored, and they have pretty low historic voter turnout. And that is just not going to do this year. We have too many really, really important candidate races and ballot measures on the August 1st primary. And so we wanted to share a little bit more context about why this is so important and really how we need you all to show up en masse and rally your colleagues, rally your clients, rally your guests to join us in this effort. So the Vet Seniors Human Services Levy, this is a considerable source of funding for our sector. It provides funding for housing, shelter services, civil legal aid, support for folks with disabilities. It supports our food banks, our senior centers, 24-hour assistance for survivors of gender-based violence. They provide one-stop shop service centers for veterans. It's mobile medical care for people living homeless. And even if your program or your agency isn't directly funded through this levy, it is a huge part of the fabric with which we wrap around folks and care for folks and, help get folks to the next phase of a healthier, more stable, thriving part of their life. You probably have heard, if you've been tracking this, that like the levy passed last time in the 2017 with 68% of voter approval. And that's great, and that's true, and that was in the general election. We're voting for it in the primary this year. It's a big, big deal. This is something that generally people get behind. They like supporting veterans, they like supporting seniors, they like providing supports that are going to help people really, really move forward in their life and bounce back and be resilient from anything that's sort of been a challenge in their life. But again, it's the primary. So we really, really want to make sure that folks know about this. So we're gonna talk a little bit more about ways that you can help people understand how they're eligible to vote, how to replace ballots, all that stuff. Tim's going to go into that. But in addition to the levy, which is huge, 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 huge for our sector, there are 16 cities across King County that have at least one open city council position. And if you've been following anything that's happening in Burien, say, my hometown, or Federal Way or Auburn or Bellevue around policies and laws that are really criminalizing homelessness, you know how important these city council positions are. So they span the county. King County Council has two positions open. It's District 4 and District 8, so roughly Northwest Seattle and roughly Southwest Seattle, White Center, Burien, give or take a few other pockets of folk. There's 11 school district positions that are open, and there's fire district measures. So this is not an election to be ignored. There's really important decisions that we get to make and influence, as we move forward. So I'm going to leave it at that because we do have a tight agenda, and I want to give Tim a good chunk of time to really let you all know how to actually vote on August 1st. Take it away, Tim.
Absolutely. Thanks so much, Jody. So I think many of the people on this call are probably already active voters. Thank you for voting. Thank you for maintaining your registration. I think this is the part where we encourage you to let others know how they can vote. I would say the first important thing to note is that a person is eligible more times than is held by popular belief. A person can vote if they have a past felony conviction, if they are currently on community corrections, if they do not have a permanent residential address, if they don't have an ID, they can register to vote. There are lots of ways, lots of reasons that a person can absolutely vote, even though they think they may not. So definitely spread the word about that. You can register to vote online. Unfortunately, you do need an ID for online. But if you register to vote via mail, you can use the last four of your social by the 24th. So we have a few more days to register to vote online or via the mail. If you want to register to vote after the 24th, you can register up until election day at a vote center in King County. I'm putting the URL for all of the locations of vote centers in King Counties. Send a person to a vote center if they want to register after the 24th, or even if they just want to talk to somebody about the registration process or have questions about their ballot. For everyone who is registered and wants to cast their ballot, we know that we can just pop them in the outgoing mailbox. However, there are also ballot boxes pretty much everywhere in King County. Some areas, such as downtown Seattle, don't have as many, but many areas surrounding us do. Head yourself to a ballot box so you can get your ballot in before 5 p.m. I believe it needs to arrive by 8 p.m. on election day or be postmarked on election day by 5 p.m. Have you registered to vote and voted in the past and are losing and have not maintained your ballot this time? Maybe you need to replace your ballot. You've lost it, you've moved. There are reasons why you would need to replace your ballot. You can replace it online, printing it out on your own printer. Wild to think that you can do that, but you can print out your ballot, the security envelope, as well as the return envelope so that you can submit your ballot without them sending you a new one. Of course, you can also contact King County Elections to request a replacement ballot as well. So that's our spiel on voter registration. Please, please, please vote. Please tell everyone to vote that you know, because like we said, there are a lot of important things at stake. In other community news, we have a couple different trainings and gatherings coming up held by the coalition and others. We have our annual McKinney-Vento provider training for community providers who work with school districts, and work with families and youth experiencing homelessness. We want to share information about the law, about the obligations of school districts, and resources that you can access so you can ensure that your K through 12 students experiencing homelessness achieve their academic and social goals. I am going to pop that training link in the chat right now. Please register for that. Join us on August 1st, Election Day. You can celebrate after having voted by joining our training. We also have a really awesome, what's called a provider shop talk. We're holding those quarterly. This is a space to share resources on what you have known to work for your clients and accessing their goals, accessing their needs, achieving their goals. We're going to be talking with Reach also about accessing IDs and social security cards, a big barrier for a lot of people, especially someone who has not been born in Washington. We also want to talk about any other concerns you have. Please ask any questions. Please share resources or ask for resources within this space. That meeting is going to happen on the 27th at 2 p.m. Register online. We look forward to seeing you there, all of our wonderful service providers. Additionally, we have some trainings available from Healthcare for the Homeless. I'm just going to drop those in the chat and encourage that you attend those. If you work with anybody who who uses substances and wants to avoid overdosing, those are in the chat. And now in this very tight agenda, I'd like to pass it back over to Jody to talk about the Public Health Emergency Unwinding.
Thanks, Tim. So we are really lucky to have a couple experts in the room with us. Hannah Rosenberger from Benefits Legal Assistance over at Solid Ground, and Janet Verone, and I apologize if I just mispronounced your name, Janet, who's the Executive Director from Northwest Health Law Advocates. This is something that we've shared out in previous meetings and in some of our messaging, so it might ring a bell, but if you haven't heard anything, just a little context. So during the pandemic, you know, a policy choice was made to forego verifying eligibility and information for folks, and they were just able to stay on Medicaid. Now that that public health emergency has ended, we are going back to the old policy pre-pandemic where people have to go through that verification process on a regular basis. And what we were told and what seems to be becoming true is that, you know, tens of thousands, if not into the hundreds of thousands of folks are being unenrolled off of Medicaid. So the onus, sadly, unfortunately, is really on folks to be updating their information with for Medicaid. It's checking their mail and seeing if they've gotten a letter saying that they need to re-up their verification. Some folks are not going to be eligible any longer because their situation has changed. But even folks that are still eligible, if they're not reaching out and following up to update this information, they're going to be dropped. And I don't have to explain to you all the enormous impact that will have on people's healths and lives. So on that, I think I'm going to hand it off to Hannah Rosenberger first, and then to Janet Veron, and then we've got some information that we can throw into the chat in terms of some links for you. So Hannah and Janet, thank you for being here. I will hand it off to you.
Thanks so much, Jody. Hi, everyone. I'm Hannah. I'm the program manager with the Benefits Legal Assistance Program. We provide pre-legal representation and services to low-income individuals and families in King County on public benefit issues. And one of the things that we work on are Medicaid terminations and denials. So that's why we're here in this space today. So just like Jody and Allison said earlier, these Medicaid renewals have resumed. And it's happening in waves. So not everybody is there. Everyone wasn't up for renewal the first month, but it's happening over these next 12 months. So if you or your clients have not received their renewal information, it's coming. And one big, maybe the most important tip that I wanted to pass on today is it's so important that people are updating their contact information. And that is phone numbers, email address, and mailing address where they can get their mail, even if they are unhoused, but they have an address where they can get their mail, because there are deadlines. So once somebody gets their renewal letter, there's certain deadlines that they have to finish the paperwork in time or they can be terminated. And a lot of people, they may have gotten on Medicaid during the pandemic, so they've never even gone through this renewal process, or haven't updated their information ever because they're relatively new to the program. So another option is folks can, if they have a Washington Health Plan Finder account or a DSHS client account that's on Washington Connections, it kind of depends on what type of Medicaid coverage someone's getting. They're going to be in one website or the other. They can opt into an e-notice, so they'll get a notice when there's a letter waiting for them. So if they are unstably housed, another option is case managers or social workers organizations can, with the client has to consent to it, they can be what's called an authorized representative. We do this for a lot of our clients. So you get a copy of letters that are sent to the client. So if you're worried about clients who are not going to be able to receive the mail timely, you, with the client's permission, can be their authorized representative and get a copy of the renewal and either help them do the renewal, do it based on what you know about the client, or at least then find the client so that they can do it. So that's a really important piece to be updating, even if their renewal time hasn't come up, to be updating that contact information so that they don't miss it. And then once somebody does get the renewal letter in the mail, it's really important to complete it within the deadline. But one thing I want to emphasize is that it's better to submit a partially completed application or form than wait to get all the information and potentially miss that deadline and be terminated. So for example, if somebody doesn't quite know how to answer the income information or they're missing something, if they submit a partial I keep saying application, but it's a partial renewal, then they'll get a follow-up letter saying, oh, you're missing this information. You have this many days to get it to us. So that keeps them from being terminated and allows them additional time. So that's kind of another tip. Partial renewal is better than no renewal or past the deadline. Clients, or again, if you're an authorized representative, you can ask for additional time for your client. We just had a situation where one of our clients was in the confidential mailing program. So if you're familiar with that, it could take a couple extra weeks to get your mail. So they got it near the deadline. They asked for additional information, additional time, and were able to keep their benefits going. There's language assistance available if clients need their documents translated, large print. They can ask for that assistance if it's not already part of they're not already getting that. And then one last thing, there are these this resource called an equal access plan, which is sort of like a disability accommodation. So if you're working with a client, sorry, I'm kind of speaking quickly. I want to make sure we get to Janet and get all this information. But if you have a client that has maybe a cognitive limitation or a physical impairment, anything that keeps them from being able to access the resources or the local offices the way someone that doesn't have an impairment, they can ask for additional assistance. That could be additional time to fill out paperwork. They can get help to fill out paperwork, have a quiet space in the office to fill out the form. So I'll just say equal access plan. So keep that in the back of your mind. And that's not just for the renewal, that's for any interactions they have with these programs. Okay, so at that, I'll pass it to Janet to talk about, if someone does get terminated or how to troubleshoot that.
Okay, thanks, Hannah. And hello, everyone. I'm Janet Barron. I'm the Executive Director of Northwest Health Law Advocates. We do advocacy around improving access to healthcare at the policy level and work a lot with advocates. We're always available to talk to folks who are helping people in the community try and navigate the complex world of Medicaid and other public and private insurance program. So troubleshooting post-termination. So first of all, the shocking fact of these over 300,000 people who have been terminated, about 75% were what we called procedural termination. So it was not based on actually finding they're ineligible. So a lot of what we call churn in the system of people who may remain eligible, but they fell through the cracks because of a paperwork requirement, not getting the mail, not responding, a whole host of reasons. So we were quite dismayed to see this 75% number. This is this is the advice we have when people are in that situation. First of all, there is an automatic period of time where you can get reinstated. So you'll have to reapply, but you have 90 days for the the Affordable Care Act's new adult medical program. It's only 30 days for what we call the classic SSI related programs, which many of the folks may be on based on a disability or being over 65. We have been pushing hard to try and get that extended. It's not going to happen soon, but the state is interested in extending that eventually. Also, for people, even the classic folks, there is an opportunity to get retroactive coverage, which means that you can apply for the past 3 months, the past 3 calendar months to get. So it's a new application, but you can get up to 3 months of coverage depending on when you receive services and, of course, your eligibility. And then there's an opportunity to appeal. So if you appeal a termination within 10 days, you are entitled to continued coverage. You have 90 days to appeal. There is now, as of last year, a good cause exception to that, which homeless folks may very well qualify for. I have not yet seen an example of somebody using good cause successfully. I don't know if you have, Hannah, but it's something worth trying. It's just very new, and I'm not sure there are even Medicaid rules about that yet. So let one of us know if you are running into problems with good cause after the 90-day period. And then, of course, if you can't do first of all, you can seek reinstatement and retro coverage and appeal at the same time. So if you're concerned about how long it takes to get through one or another system. Cover your bases. Act quickly to enroll in new coverage if you're not eligible any longer. The window for enrollment in new coverage, like through the Health Plan Finder, may be limited. Health Plan Finder, as you probably know, it's where you can get a qualified health insurance plan with subsidies depending on your income. 80% of people can find coverage at less than $10 a month. There is also cost sharing and other things associated with it, but it's a way to get affordable coverage. For Health Plan Finder, keep in mind a 60-day enrollment period, because if you don't enroll within 60, you may need to wait months for open enrollment. Medicare is the other option for people over 65, people with disabilities who cannot work, and those Medicare is something we're very worried about, the seams between Medicare and Medicaid and then Medicare, people being terminated from Medicaid but not getting Medicare in a timely way. You need to apply separately, and the way there are many complicated options. We advise getting help from a navigator or SHIBA, the insurance commissioner's statewide health insurance benefits advisor. It's a volunteer program, and these volunteers are very knowledgeable about how to help people with transition to Medicare. Sorry about that. There are also, to make it a little more complicated, affordability subsidies through Medicaid, through the Healthcare Authority, called Medicare Savings Program. So for people whose income is low, they can get help with premiums and cost sharing. We know this is a rough transition for people because they're used to having free coverage until they turn 65, and then suddenly they have costs. We've done a lot of advocacy work around that, and are always interested in stories of people who are having problems with that system. Another thing I want to let everyone know of is there's scamming going on around this transition. So beware of scammers who are pretending to be from a state agency, the Healthcare Authority, or they might say Apple Health, and who ask for banking or credit card information. You know, it's a variation on things you've heard in other contexts, but you know, take advantage of this transition period and try and get people's banking information. Very troubling thing, and the state's really interested in hearing from people who have gotten these calls, by the way. If you want more information, it's in our blog post, which I think someone might have posted, or I can at the end. Oh, good, thank you.
We did. And Janet, I am so sorry. We asked you and Hannah to join us knowing how time sensitive this is.
And I'm sorry for running over. I'm done. Just watch for these problems. Unhoused people, people who've never experienced renewals, kids under 6 should not have been terminated at all, and people who became eligible for Medicare. So that's it. And sorry to run over. If anybody has questions, I'd be happy to answer offline or in chat. Thank you.
Thank you so much, Janet. And thank you, Hannah. Really, we apologize for asking you to jam so much important information into a short presentation, but I want to say a couple things before we move on just quickly. First of all, Hannah and Janet and their colleagues are our most wonderful allies because they, as you can hear, understand the deep technical nitty-gritty details and the big picture policy issues. You all are helping people on the ground, the folks whose experiences should be informing policy. So the reason we invite them here is twofold. One is to share the great information they just did and give you a heads up so you can help the folks you work with. And two is so you can give them information. If you run into problems, these are the folks to call. And they've both shared, I think, ways to reach them. And if not, we'll ask them to put that information in the chat, because this is the feedback loop that the coalition exists to generate. What is actually happening on the ground should be informing our advocacy and our policy work. And our policy and advocacy work should connect to the realities for people experiencing homelessness and housing instability. So I asked Tim if he could put in the YouTube link for a training that Hannah recently did with us as part of our Public Benefits Are Key, which goes into more detail because there's more time about Medicaid and Medicare. So thank you, Hannah, for doing that. And Janet and Hannah, please keep us informed. We will welcome you back because we understand this is a rolling process. So thank you both so much for the work that you do and for joining us to make this feedback loop helpful. I am going to take us to the next part of our agenda, which is a related example of the feedback loop that we endeavor to create together with all of you all the time. And that is related to behavioral health and the availability of behavioral health for people in crisis. I think we all understand how great the need is and how very limited the responsive services are. One of the things that I've found myself saying to people recently when they comment to me about, well, it just seems like people are in a terrible situation and there's so many people in crisis and what's going on, is we left 45,000 people experiencing homelessness outside for 3 years during a global pandemic, and they did not get better. They experienced additional trauma and hardship and suffering. Of course, people are in crisis. Every indicator that we see tells us that, the systemic reasons that people experience behavioral health crises have deepened and worsened, not improved. And our systems are actually losing capacity. So for all of those reasons, we know that we need to be active partners in some really exciting and important work that is happening right now in our community. And that is the work of determining how to use the resources that voters approved in April by passing the King County Crisis Care Centers levy to not only create these 5 new crisis care centers, which to be honest, won't be built for quite some time, but to generate the resources and services that folks need. Potentially services can come before a building is available to open. And so we're really thrilled to have Kate Baber, who is the director of the Crisis Care Center's implementation planning process, here with us. I will introduce Kate properly in a moment, but it's really a principle here at the coalition that we don't only talk about something that is theoretical or in process or will be coming. And Tim and Jody and I talked about this. The reason for that is our goal is that when you come to a Coalition on Homelessness meeting, you leave with some sense of solidarity, community, and information to help you do your work and do it well. And we need to recognize that the planning is essential, but the planning is not going to help you respond to a crisis, a person experiencing a crisis this afternoon in your program or on the street. So therefore, we're really grateful. We're going to take just 10 minutes to welcome a couple of our valuable community partner and member organizations, Crisis Connections and the REACH program, part of Evergreen Treatment Services. And we're so grateful to Neil Olson and Hector Herrera, who are joining us to talk a little bit about what is currently available, what's the experience of calling Crisis Connections, and what should you be aware of that you can make use of now. And after Neil and then Hector have shared a little bit with us about that, we will transition to Kate. So thank you very much, Neil and Hector, for joining us. We know that, again, we're asking you to cover complex information in a short amount of time, but we think that you can give people a taste and information. And I will start with you, Neil. Thank you very much for joining us. Neil is the Senior Director of Strategic Initiatives with Crisis Connections. And please go right ahead, Neil.
And Allison, you need about 5 minutes. Is that okay? Well, good morning, everyone. I've worked with lots of you on the call, and some of you it's the first time meeting you, so hello. So Crisis Connections operates several lines. We operate the Washington State Recovery Helpline, the Washington State Teen Link Program, Washington State Warm Line. We are also your 211 provider for King County, as well as the 988 provider for King County. And we've operated regional crisis lines in 9 counties across Washington State, and we've been your regional crisis line since 1964. We're the second oldest crisis line in the nation. And we have been doing 988 work for 1 year and 4 days now, since the 988 number went live. And so one of the questions we were asked is, what happens after you call 988? So what I would ask you to do today, when you have some free time, is actually try it for yourself. What will happen when you call 988 is your cell phone company will route that call to New York, and you will hit what's called an IVR, or it's an interactive voice recording. It'll take you about 43 seconds. It'll give you options for veteran-specific crisis services, LGBTQ-specific crisis services. If you are a Washington resident, it'll ask you if you're interested in Native and Strong Lifeline. And after that, it will route you to your local call center. So if you live in King County, and it specifically, if you have a King County area code attached to your phone number, or 206, things like that, you're going to end up at Crisis Connections, and your call is going to be answered by trained staff who work for Crisis Connections. We're going to do a couple things. We realize that crisis can be, somebody needing a tangible resource or a tangible item. And so we might link you up with resources or referrals. We might push you over to 211 so that you can get information referral to a full web of 30,000 plus resources. But we also realize that folks may just need emotional support. And so really that's the service that 988 is going to provide, is crisis intervention, active listening, really getting a good conceptualization of the crisis that person is facing, suicide assessment, and then if needed, follow-up services. So our 988 team is set up with the providers in the region. So we can make referrals to the mobile crisis team, the youth mobile crisis team, the young adult mobile crisis team. We can make those linkages back to the designated crisis responders. We can make referrals for a next day appointment. A lot of those things that have historically been available through our regional crisis line. We didn't want there to be a wrong door. We didn't want clients to have to figure out, do I call this one or that one? If you land at Crisis Connections, we want to get you to the right place and the right resource at the right time. There are a lot of documents that are out there around frequently asked questions. So I'll put those in the chat for everyone so that you guys can research those on your own. We're more than willing to provide longer presentations. We're more than willing to give a full breakdown. And we've also started hosting listening sessions at Crisis Connections, so that folks can come in and actually hear how calls flow through the system, how they work, how do we triage them, how do we get them to the right place, how do we make referrals. And we're also looking at the folks who are starting to work for the crisis care centers on how do we make sure that Crisis Connections can be a front door into those centers. We really think that'll be effective, making sure that system works in an integrated way. And then the last thing I'll probably put in the chat, just because you guys are focusing on King County homelessness, I'm not sure if you guys are familiar with 211 counts, but it is a massive resource of data that 211 gathers on callers around, service needs. You can break it down by legislative districts. It will really help you from a grant writing perspective, from an advocacy perspective, from a, hey, what are the needs of the community perspective? So I'll put that in the chat for you all as well.
Thank you very much, Neil, for that very quick and useful overview. Hector Herrera, thank you so much. I know that you are with our friends at Reach and LEAD, and I will let you introduce yourself because I don't know your title. And thank you so much for joining us to talk about what the in the field resources that you all are part of are for people to be aware of. Please go right ahead. Thanks.
Hi, thanks, Allison. Hi, I'm Hector Herrera. I use he, him pronouns, and I'm the lead supervisor at the East Precinct and for the True Blood program. So just a real quick overview of LEAD. We are law enforcement assisted diversion. Our referrals come from police officers in the field who are seeing a lot of activity from folks with severe and persistent mental illnesses and TBIs and a high degree of drug use. The goal really is to prevent the cycling through the legal punishment programs, and diverting folks from that, as well as like supporting while we mitigate other cases. But because of our True Blood work, which is with folks who have had competency raised in courts, we are experiencing a lot of just work with folks who have a high degree of like escalation in the community. So folks have kind of reached out and asked, what do we do when there is someone, just if you're just witnessing someone on the street who's having a crisis? And Neil hit it on the head. I think the number one thing is to use a crisis connection. The other way to go, the more traditional and sometimes problematic route, is calling 911. The problem with that is that often a police officer who is not trained in crisis response will show up. So if you are going to go the 911 route, you want to call 911 and ask for the crisis intervention and response team or the search team. You also, yes, I was told to not use acronyms. Thank you. Traumatic TBI does equal traumatic brain injury. So that's why the CIRT team or the CERT team is the crisis intervention and response team. Each police precinct will have a number of officers who are trained in crisis de-escalation that will respond to folks having mental health crises in the community. And then when they respond, it's really important to just communicate with the police and sort of give them the lowdown of what's going on. Any sort of like background interaction or background information that you have. So I'll give you an example of what has happened at the East Precinct. Our office is on 15th and John, which is like a very high traffic area on Capitol Hill. So we had a client who was in crisis, lying in the middle of 15th Avenue, right in front of Kaiser. So there's a lot of traffic and she was just lying on the street. So we ended up having to call 911. SPD showed up and we did ask for the crisis intervention response team, but they weren't available. So they just sent the first officers that were able to come. LEAD does have an existing relationship with SPD in the East Precinct, the West Precinct, in West Seattle. And luckily these were officers that we know and that we already had rapport with. So we were able to kind of communicate, and they and more often than not, these cops are going to know the person who's having the crisis. So if you can give them a sort of like rundown of what's been going on lately and what interventions you've tried in the moment, you can really sort of help out. Well, what ended up happening with this client was that she moved off the street on her own and then went into a local bakery and just started sort of taking stuff. And so at that point, LEAD has flex funding through the True Blood dollars. So we can just pay for the stuff that she took. We just went ahead and just paid for the coffee and the candy and the sandwich that she took. And the business owners were really responsive to that. I said, I'm just being very transparent with you here. Like, we are here for, we're not a crisis response program, but this is a client that we've already been working with. So we are able to sort of spend some flex money to keep her out of jail at this point. We just really do not want her to get arrested. When the cops finally did show up, I explained the situation and I said, is there a way to call the mobile crisis team? So the MCT, or the mobile crisis team, is a DESE program that can transport people to the hospital or to the crisis solution center, which is it's another diversion program that will prevent people from going to jail or hospitals and sort of stabilize them, their mental health. So I saw in the chat someone say that like it takes hours. Sometimes, yes, the cops did say, if we call the MCT, we've tried to call them before, their response time right now is 4 hours. So that's a huge gap in the system. And I think for outreach workers in the community, what we've ended up having to do is just sort of like provide that de-escalation in the moment. And so that's just kind of, I just wanted to, there are gaps in the system and there are problems here, but programs like Reach, who are doing outreach, like we're trying our very best to like work within the system and also to kind of like try to reform that in any way we can, so that people aren't putting themselves in danger by having police called out to see them.
Were you just pausing, Hector? Are you trying to respect the time limit that we gave you?
I'm very respectful of
Yeah.
time limits.
Yes, thank you.
I'm very happy about ending early.
I know. I'm so grateful to you, and I just want to say this is exactly why we actually asked you and Neil to come talk a little bit about what exists, because what exists, as you have said, and as people have named, and I think that both the people who talked about the delay in police response are actually housing service providers, the outreach workers, people who are in shelters, people who are working in a housing context, and those of us walking down the street are all witnessing the same thing, which are gaping holes in the system, not just gaps in the system. And of course, we are incredibly grateful to the folks at LEAD and REACH, to the trained folks who are part of the mobile crisis team, and to the alternatives to police response who are trying to stand in the breach. We also appreciate that there are police officers who are interested in de-escalation and in using their skills appropriately. And we know we need so much more. So I'm going to transition us. I think, Hector, we will probably invite you and the mobile crisis team back at a future point to give you more time. But now what I'd like to do is turn things over to Kate Baber. I'm just going to give her a brief little introduction. The Crisis Care Center's levy passed in April, as I said before. This is a levy that I think everybody who worked on it understood was necessary, but not sufficient. So we were all aware that this sounds like a lot of money, as you will hear, but it is, first of all, backfilling services, including inpatient beds that we've lost, and trying to fill some of the gaps that we are all painfully experiencing. And I want to recognize that pretty much every single service provider on this call is a de facto crisis response provider, whether you've been trained for it or not. And that is an incredibly difficult thing. I see somebody's already asking, will you get the slides from Kate? And the answer is yes, you will. So I will just say Kate Baber has an extraordinary collection of professional experiences and backgrounds. And I would say to you all what I said to her, which is I cannot think of a better person to have been hired for what is an extraordinarily complex and difficult job. And we're so grateful, Kate, to you for reaching out to the coalition early on to include us in your planning, to listen, but also to make sure that our folks are looped in, to support and help you and your team in the work that you're doing on our collective behalf. So Kate, thank you for being here. And we will provide Kate's slides to everybody.
Thank you, Allison. How's my audio today?
Looks good. Sounds good.
Wonderful. Hello, everyone. It's so wonderful to be here. I really appreciate seeing many familiar faces and also new faces today. And I'm grateful for the opportunity to share about the Crisis Care Center's levy. Also, thank you, Neil and Hector, for just the tremendous services you provide. Kent County is very lucky that you're here in our community. Thank you. So I'm here today to provide an overview of the Crisis Care Center's levy. And I want to go back to what Allison said earlier about the feedback loop. And that is, I really appreciated that framing, and that's exactly why I'm here today. I'm here to share information about the Crisis Care Center's levy, to provide some context, share what's included in it and what the planning process will look like. But I am especially here today because we at King County need and want to hear feedback throughout the process, even though these services will not be up and running for a few years, so that we're hearing directly from direct service providers, hearing your perspective, hearing your expertise, understanding a little bit more about what you're experiencing, what opportunities and ideas you have, so that we can incorporate them early on in the planning, so we don't get to a point where we're implementing a system and haven't talked to you or haven't thought about something really important. So I'm going to share a little bit. I have some questions for you. I'm glad to answer any questions you have today. And if we run out of time, my email is on the slide deck. I'll put it in my chat before the end of the call, and would welcome hearing from any of you in the coming months. With that, I will jump on in to provide some background about what the Crisis Care Centers Levy is. And I'm even going to back up a little bit further to talk about King County's role in behavioral health services. And some of you are behavioral health providers in addition to homeless service providers, and some of you may be less familiar with the behavioral health system. So I'll just provide a brief overview. King County and the Department of Community and Human Services in particular, and within DCHS, the Behavioral Health and Recovery Services and Recovery Division, manage King County's outpatient behavioral health system for people who are enrolled in Medicaid, people living on lower incomes in King County. And that includes service providers, behavioral health outpatient service providers who serve people who are experiencing homelessness, living outside, living in affordable housing. The county has an important role in partnering with behavioral health providers and managing that system in partnership with Washington State and managed care Medicaid health insurance companies. That's the outpatient system. On the other side of the behavioral health system, there's a crisis system for people who are experiencing behavioral health crises, who are seeking or need immediate support. And the county also has a very important role in managing and administering that system. And we collaborate very closely with organizations like Crisis Connections to support a continuum of behavioral health services. So similarly to how there's a housing and homelessness continuum in King County, there's also a behavioral health continuum in King County. And as many of you have reflected on during the COVID pandemic, we've seen just lots of stresses, pressures on workforce, on people experiencing homelessness, people who are housed, and an increasing need for behavioral health care and behavioral health crisis resources. And the levy came from a place of there being significant gaps right now in King County in that behavioral health continuum of care. And there are a number of gaps, and there's some really big ones that this levy aims to address through new resources related to crisis care centers, particularly places for people to go when they are experiencing a crisis. That is the first element. There's also a huge gap in what are called residential treatment beds, mental health treatment beds. Our community's lost a third of these beds since 2018. So the levy is seeking to restore capacity, and then also seeking to stabilize and grow our behavioral health workforce. So I'll talk a little bit more about each of these briefly before jumping in, just to provide you with more context. So the Crisis Care Services Levy passed in April of this year. Thank you for all of your support to make sure that happened. And what we are now doing is working to develop an implementation plan that will be a high-level budget and policy document to guide the implementation over the levy between January of 2024 and December of 2032. And that implementation plan is going to address the three goals on this slide. The first one being creating a new network of behavioral health facilities that don't currently exist in King County. And these will be called crisis care centers. There will be 5 funded and created by the levy. and they'll be distributed in 4 different regions of King County, one in North, South, East, and Central King County, and one that's countywide serving youth. Allison, I see your hand up.
Yes, I'm so sorry, Kate. I just want to alert you to the fact that your fabulous colleagues are messaging you on Teams, and because you're sharing your screen, we're seeing their messages, and they're lovely. And I'm going to put the blog post so that everybody else meets the rest of your team, but you might want to mute your Teams messages.
Thank you. I appreciate that.
Welcome.
Let's see here. So these 5 crisis care centers, they will have 3 different components. One is a behavioral health urgent care center. So this is a type of facility that does not currently exist anywhere in King County. And the intent of this is for when someone is experiencing a behavioral health concern, and a concern or a crisis that they define themselves, this will be a 24/7 facility that anybody can walk into and get support. And so that can be an individual experiencing a behavioral health crisis or concern. A homeless service provider could bring in a participant or a shelter guest that you're working with. It could be a resource for law enforcement, for example, to refer someone to anybody in the community. And there'll be a team of behavioral health, medical and clinical staff who will be available to assess people, refer them to other resources, and help them access stability. So that's the first component. The second component is it's a campus, and this is a component that will be attached to a crisis care center, is what's called a 23-hour observation unit. And this is a specific type of behavioral health facility for somebody to stay who needs more intensive support and observation by clinical and medical staff to help continue to assess them, support them, and refer them to the next level of care. That could be a higher level of care, or that could be coordinating support so they can go back into their community and continue to receive services. And then there is a third type of facility called a crisis stabilization unit. And this is a 2-week facility where people can stay up for 2 weeks to continue to recover from their behavioral health crisis, continue to receive services, support, and work with staff to coordinate what that discharge looks like, what that connection back into community looks like, so people can continue to stabilize. So that is what a crisis care center will be. The first one will not open until the very earliest 2026. This is a ways away, and right now what we're doing is really developing some of the high level planning, and want to hear your feedback as part of that planning. The second thing the levy will do will restore the number of mental health residential treatment beds. So these are longer term facilities where people can live and receive intensive behavioral health supports. These are licensed as clinical facilities. And again, we've lost 1/3 of these beds since 2018. So the levy is seeking to both stabilize that sector, that type of service, and then restore capacity in King County. And then of course, we cannot do any of this without essential behavioral health workers. And so we'll be working to grow the behavioral health workforce, stabilize and retain the workforce, and diversify the behavioral health workforce. So where we're at right now, we're working on an implementation plan. The proposed plan will be finalized by the executive branch of King County by the end of the year. And Executive Dow Constantine will transmit the plan to King County Council for review. They'll have an opportunity to amend it, and then they will pass it. Likely the beginning, Q1 or Q2 of 2024 is the timeline we anticipate, although that will be driven by King County Council. And then at that point, after King County Council passes it, then we can move from planning to actual implementation. And there'll be competitive procurement processes and work to actually get what is envisioned in the implementation plan and in the crisis care centers levy to implement that into fruition to bolster our continuum of crisis services. So again, going back to the feedback loop, this is not the last time we hope to hear from coalition members, and we'll certainly seek your feedback during implementation, and then also helping people learn how to use a new system, helping a new system adjust as it's implemented to meet needs. And so that continuous feedback, I think, will be really valuable. I want to pause and open the floor for questions. I'm glad to answer any questions that you have. I have 3 specific questions for all of you that I would love to hear. So 1, can you think of a time when a person you were working with needed behavioral health crisis services? What did you need? What did you get? And was it useful? The second question, how can we design crisis care centers so that people experiencing homelessness want to come to them? So this one, I really would value your feedback on today in particular. And then thinking ahead to the future. So, 5 years from now, when these new crisis care centers are up and running, what would they need to show you? What would King County need to show you to demonstrate success? I wonder, maybe coalition staff, would you mind if you can copy and paste those in the chat so people can reference them? I just want to fly through the rest of my slides so you can know what's coming to your inbox. I have just a list of regular partner engagement meetings. If anybody would like to be more closely engaged, there's information about how to get involved. We have a survey where we'd love to hear your feedback. And then just some behavioral health crisis resources. These are primarily Crisis Connection resources, lifelines that Crisis Connections operates, and then some additional resources of how to access behavioral health services in King County, both mental health and substance use resources. With that, I will stop sharing and just open this up for questions, feedback. I'm taking notes and would love to hear any reactions or ideas.
And I think while people are thinking about these really excellent questions, Kate, maybe just a suggestion that we start with folks who are direct service providers. We have a wonderful range of people who attend our membership meetings, and we want to hear from everyone. But I think people who have either personally experienced behavioral health crisis services or tried to access them, those are the folks we'd like to start comments and questions, start hearing from. Thanks.
Dennis, go ahead.
Hi. My name is Dennis Bateman. I work for CCS. I work in low barrier harm reduction 24/7 enhanced shelters. Been doing it for 5 years. We bring people in off the street. Some of our people are CEA referred. I'll share a time with you, one of like hundreds that I've experienced over the last 5 years, where a person went into a crisis. It was drug-induced crisis. It wasn't illustrative or it wasn't reactive. He was upset about, I don't know if he was reliving some of the trauma he experienced in his life, but he was in a full-blown crisis. He was on the 5th floor of a building that we were operating downtown, and he was threatening to jump out the window and hurt himself. He was threatening to my staff, so which just happened quite often in this program, this particular program, and it does still happen in our programs. I called 911. The officers showed up. I couldn't get him to go get help anywhere unless he was threatening to harm himself or someone else. They were just going to walk away from the scene. I think we did contact some crisis center. I can't remember, it's been a few years back, but they weren't going to be available. They showed up like 2 days later, and we're going to help us with this crisis. This has been like this kind of a situation goes on all the time in these low barrier harm reduction shelters that I've worked in, where so I couldn't get this gentleman, to get help in any way. I mean, they would assault somebody else and that person didn't want to press charges, and then that way that he wasn't taken away to get help. So that's been a major problem. I've experienced work in, supervising advocates at the front desk, as this happens a lot, and the system's really broke where, to get that gentleman to get help, because I knew he was going to jump out that window. I'm pretty sure he was in that state. We would de-escalate people, and we use all the skills we've been trained in to de-escalate people and bring them out of their crisis and move them from their primitive brain to their evolved brain, and with a certain way we approach people. But so the only way I could really get him help was, I had to kind of I'm not really proud of what I had to do, but I had to kind of I think he said he was going to do that, so I had to kind of make up a little story to get this gentleman to get help. And I was kind of not really proud of that behavior I did at the time, but he needed help. So that was an incident, one of hundreds I've dealt with over the years, of people going into crisis, calling for help, people showing up 2 days later to give help. The person's already out of the crisis, or if they, the officers showing up and 911 calls where they couldn't do anything and they would just leave. So yeah, thought I'd just share that with you, because I think that was one of the questions, right? To share something that's happened, and it still happens to this day. We have no resources, nothing, nowhere to, if we can get them to a 72-hour assessment and harm review, they're released and they come right back. We do work with some people at harm review, a couple people that work with, to help us with medications for some of the people that we try to get on medication. We do work with the CREW program, and they kind of help us with their mental health counseling. But it's a process to bring somebody out of a traumatic life, and it doesn't happen overnight. It's just really challenging, heartbreaking to see people. You're trying to help people rebuild their lives and move forward. And, our mission is to get people into apartments in their own places, and then they can rebuild their lives from there. But it can be really sad to work in a system where you can just do all you can and take all that secondary trauma and try the best you can to help people, and there's no resources. So I'll leave it there, so I don't just keep blabbing on. So whatever. Yeah.
Thank you, Dennis.
Mm-hmm.
Thank you. I appreciate you sharing that. Thank you for your work.
Yeah.
Yeah, thank you so much for your work. I think you're giving voice to a lot of what people experience in doing this work, but I know we have people on this call who may not be in this work, so you've really helped to describe why this is such a critical area, need for really careful, thoughtful, and comprehensive additional care.
Mm-hmm. Thank you.
Thanks.
Somebody say something. Gosh, I didn't mean to traumatize everybody. It's just like, I'm okay. I'm taking time off from work. I've been off work for like 3 weeks. I'm disconnecting from my job. I just happened to see this, and so we're okay. We're doing our work. We're making a difference. So it's okay.
Thank you, Dennis.
Yes, yeah.
I will just say, I am really, really so happy to see and hear from you because
Yeah,
we haven't connected in some time, but you are fixed firmly in the coalition's history as one of our most wonderful early voter registration and voting rights volunteers. So
yeah. We did a
great,
good
great to
job.
see. Yeah, maybe we can reconnect on that. Is there someone else? I think Karina just unmuted, so please go right ahead.
Yeah, I'll just, I have also experienced that, in fact, as recently as Sunday morning. But I also have a long-standing need of folks who maybe are not able to initiate getting mental health services, maybe don't think that they need mental health services. But I have this dream of an outreach worker who's a trained mental health person to engage with folks who maybe don't recognize that as a particular need, but need to build a relationship with somebody who can deliver mental health services. I right now have a client who actually hasn't left property in 4 years and really needs some services, but I don't even know where to start because people who are trained in delivering the right services just don't have space in their world, especially on the east side. I mean, there's a lot fewer services on the east side to come out and build that relationship with somebody who really can't initiate the first contact with services by themselves.
Thank you for sharing that.
From my experience, working at my last job with youth, doing wraparound specifically, and working with youth who ended up going to CLIP programs, which were youth long-term crisis inpatient centers for mental health. I often found that they were understaffed and the youth weren't actually getting the services that they were in intensive inpatient care to get. So I had one youth that was in the CLIP program and did not have a mental health provider for 2 months and was there for mental health services, or had a different mental health, another youth who had a different mental health provider like every 2 months, it seemed like, or a different caseworker. So just issues around staffing, and then also staff having the expertise or training to be able to provide intensive and trauma-informed care.
Thank you. It's great feedback. Anyone have thoughts on question number 2? Thinking about designing a new crisis care center, a new place where people can come and access behavioral health services. Do you have advice for us of what we can do to design them to make sure that they're welcoming to people experiencing homelessness, and design them in a way that people want to come and receive services or receive help?
Yeah, I have another idea around this. For barriers for entry and or bureaucratic paperworky processes, that could be like a huge deterrent, whether someone's already accessing services and they're like, I have to explain the whole difficulty that's really traumatic that I'm experiencing all over again to some stranger and write it down on all these papers. Or if they haven't engaged in services and they're trying to now, and that can just be really daunting to be like, okay, fill out these 5 forms before you can even be seen and sit in this lobby, or the kind of the red tape barriers to entry with like, okay, you have to have this service provider refer you and make sure to get here by this time for your appointment. So I would hope that some of those barriers, that someone can just like walk in, be welcomed, and start getting services immediately without having to be like, okay, what's your name? What's your social security number? How many siblings do you have? What's your health history? But that they can if they're there on an urgent need and might be going out on a limb to do this, that they can just be immediately welcomed and immediately start getting support.
I love that. I love the vision of walk in, be welcomed, start immediately receiving services and support that they need. Thank you.
Also, if there's any way to combine like some other function that somebody might have to spend all day doing, so that it's not like another day I have to go and get services. Like if there was a shower on site, or if there was a meal program or something else that people have to take a certain amount of time. So it's like, oh, I could do both.
It's a great idea. Thank you.
Laundry.
Hi, my name's Lee. I felt like I took this question very literally of design, but I used to work in co-leads homeless shelters, and there's 4 different sites, and they were all very different settings, but I found that one that people really enjoyed was one that used to be a dorm. So it was very like homey feeling. So there was this like there was like a central kitchen area, and I know like the crisis center would be different, but it was very communal feeling because it was literally built into like an old home. People just felt like that sense of community. There was like a little garden in the front, and people would just like sit out there, and like some people would smoke cigarettes, some people would read books, and it really just was very peaceful. And it was like out of the downtown area, and it was just a place where like there'd be like rabbits running across the grass sometimes, and it was a very nice place for people to just kind of be.
Thank you. That sounds like a lovely place.
So I have a question. So this question's like, you're asking how you can design a crisis care center that people experiencing homelessness will want to walk into. I mean, so you got people on the street in crisis, whether it's drug-induced crisis, or it's illustrative, or what kind of crisis they're, whether it's, you know, from the trauma they've experienced and it's some coping mechanisms they've developed to deal with that trauma, or so they're in crisis to keep people away from them so they don't get attacked, or, you know, more trauma is brought on them. And they're in the middle of a mental health crisis, and they're experiencing this every day, either reliving the trauma. And so you want to start a facility or open a facility where people will want to come to that place to get help for the crisis that they're experiencing. I'm trying to figure out, you know, I'm not trying to be like, you know, mean or anything like that, but I'm just trying to figure out how, so is it like an outreach program that you go out and you outreach people and say, we got this to offer? Why don't you know, you come on really kind and compassionate to people and non-judgmental with a trauma-informed care language and your approach, and say, hey, you know, why don't you come with me, and let me walk with you for a while, and we'll see if I can get you some help, you know, for your feeling the way you're feeling, or let's go. So is it, do you outreach the people on the street to bring them in? Or are they people coming in through shelter settings and permanent supportive housing that they've been put into, where now they need to address their trauma and work through that so they don't go into these crisis modes? And so, you know, these centers are going to be like full immediately. Looking at the way the population that we serve is like, so I'm trying to, well, so it's like you say, rabbits running across the grass, and there's like, you know, and fountains, and I know that's kind of cool. You know, I would like to go there. It's like, that would be cool. That would attract me to go there because I understand the serenity. It's like, yeah, maybe can I hang out for a while here? But I don't understand. I just don't, maybe I'm not quite clear on how we would want, you know, a lot of people don't want to come and address these issues they have. A lot of people don't want to face that pain. And that's why there are these coping mechanisms that they've developed, you know, the drugs or going into, you know, crisis modes to protect themselves on the streets, to keep people away. You know, this has become a lifestyle, and this is the way they've lived and survived. And to get them to want to come in is like pulling teeth. I mean, it's like sometimes people will, you know, reach a point where when they come down off the other side of that crisis blowout that they've gone into, and a part where you just got to be with them. You can't do nothing. They'll come down and they'll apologize for their behavior. That's when you can get people. It's like, you know, they'll want to go maybe address some issues or try to think maybe that they need to get some help with what's going on. But I don't know. Maybe I looked at the question wrong. Maybe I read it wrong, but I just don't think people will want to just like, hey, I think I'm going to go to that crisis center now. I just don't see that. I do see them though, like coming in from permanent supportive housing, shelters, crisis teams on the streets they're outreaching people and bringing them in and trying to, you know, start the process of, you know, recovery. So, but I don't know. I wish I don't know. I don't know how to get them to come in like that. I just can't figure that out.
Let's take a couple minutes, and then I'm going to offer a suggestion for how to keep the conversation going. Thank you, Dennis.
Dennis, excellent questions. It's a broad question, and there's not a right or wrong way to interpret it. I mean, places can be welcoming on a lot of different ways, and how they're physically designed, where they're located, what the service philosophy and approach is, the scope of services, all the things that you all have named. You know, the intent of these will be to be a physical, outpatient, urgent care clinic where anyone in the community can walk in if they have a behavioral health concern, if they are, you know, a crisis that they're experiencing, that they define themselves as a crisis. And you're spot on that how people get there and the engagement to get people there is going to look different for different people based on their needs. And so I could envision we have some amazing outreach teams right now in King County, and yet there's no place for them to take people to be assessed and access healthcare service. So this is kind of like, could be, I hope, a next step for those outreach teams, just to name one scenario, or for a shelter supportive housing staff to help someone who's a resident who needs more support to help facilitate accessing this, instead of right now just really having nowhere to turn. A lot of fabulous mobile services, although as you've all named, I mean, I wouldn't say there's any sector that's adequately at capacity right now, and that's a challenge. So these questions and prompts are really helpful for us to think about. I'm taking notes. I'm seeing the chat. There's awesome feedback in the chat. I'm going to note that down too, and just continue to invite engagement and you know, challenging our thinking. We want to hear from you. That feedback loop is just it's really a gift. So I appreciate hearing from you today.
Thank you so much, Kate, and thank you to everyone who offered comments and questions and suggestions. It's rare, to be honest, to have the opportunity to genuinely help to shape a significant new set of resources and services. And I put in the chat a question about whether or not people would like to be able to continue this conversation. We can work with our membership and with Kate and her team to continue this. You know, I think you are being invited to share your experience and expertise and your very practical dreams, I would say. You know, bunnies running across the lawn, maybe not. but but good staffing and other things that make a space genuinely welcoming, particularly to people who may not generally feel welcome, there are lots of ways to do it. And I think we'd like to offer to you all and to the team working on this whatever would be helpful as we go through the process. We're so grateful, Kate, to you for your work and for your openness and invitation to join in. I also just want to highlight that the staff is hosting monthly kind of big high-level overview meetings once a month. And they're really useful, especially for people who might not be direct service providers, but who want to understand what's going on and stay up to date on that. So we'll make sure to share that information with people along with the work groups that Kate also shared. I think we are at 10:30 now. So we do always want to make sure that there's time for people to share member updates. There's some pretty significant stuff going on in Burien. There's pretty significant press release from the ACLU, which I can talk about very briefly. If you need to go, of course, we understand it. Please take Kate up on her offer to hear from you separately. And let's just see, I think, Nancy, I might just call on you to give a quick update. And if there are other folks who need to give a quick member update, why don't you get ready to unmute yourselves or message Tim or me. Thank you.
Yeah, sure. I don't know. I think I live in Burien, so this would be a Burien update. And we've been in the news a lot lately because our city council can't seem to get it together to accept $1 million. And there's all sorts of hair splitting going on around what accept the dollars means, with the city manager literally saying that the council does not need to accept the money, but they absolutely need to identify a site and change zoning. And those are two actions they need to take to accept the money. So I would push back, if I were in this group, on anyone who tries to suggest that Burien does not need to take action, because we absolutely do. We have a 4-3 split on the council. We have 3 really good progressive council members trying to get things done. We have 4 who are working basically pretty closely with the city manager to slow walk everything to the most painful degree. This has been going on here since February. In the end of February, council directed the city manager to come back with options. The first time he came back with options was this last Monday night, nearly 5 months later, and none of the options had been vetted except the one, which is a city-owned lot that could be up and running by now had they taken action. But there is a lease with a big local Toyota dealer who, as a side note, is donating to campaigns for people who are running right now. They are also at this last meeting, after basically saying, let's continue to look into what might be available 5 months later. Not this meeting on this coming Monday. I found out it won't be, but there will be a very probably well thought out ordinance for a camping ordinance citywide, no camping, excuse me, ordinance citywide. There is probably the votes to get that passed, and they are modeling it after Bellevue, which is especially problematic because Bellevue's has written in it that intoxication and not accepting housing because of intoxication is a choice. And so people can be criminalized for not accepting sober housing, even if sober housing could kill them if they stop using that abruptly. And so it's really an emergency situation here. And like I just keep a lot of us here, and I know that there's been a lot of help. Allison, you've been great. Jody's been great. Like throwing up our hands going, help, 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 please. So I'm also interested to hear about more analysis of the ACLU, because I did get their information, but I'm not a lawyer. I don't understand that.
Yes.
I don't understand if they're saying we're going to help or you're on your own. So
Yeah.
I just don't know how to stop what's going on. I think a lawsuit is the only thing that will stop what's going on. And I'm very concerned about this being unchallenged and what that will mean for other small cities in the suburbs, in the King County area, watching this happen unchallenged and being like, yay, let's go. And the problem getting too big.
Absolutely. Nancy, thank you. Really, really thanks to you and many other people who are organizing very effectively in Burien, but also with a lot of frustration, as we can see, because there is tremendous inaction, and really we share your concern about this setting very terrible precedent in a number of ways. But ultimately, what we know as organizers, as advocates, and as community members, wherever we live, is smart, relentless organizing pressure and insistence on accountability from local elected officials and the staff who work for them is the path to success. Unfortunately, it is not instantaneous. So we're going to work on multiple fronts. We're going to continue to support you. We know there's stuff going on in other communities as well. Right now, I have a request into the King County Sheriff's Office for information that they're sharing that I'm concerned about. And so thank you for continuing to do the work and for updating us all. Just briefly, for folks who might not be aware of this, there is what's called a summary judgment, a preliminary judgment in a case that the ACLU has brought against the city of Seattle. And that is not fully explicated either, but I just put a little analysis from Erica Barnett's Publicola in the chat for people. The good news is that a judge has said that the way the city of Seattle is treating what they call obstructions, meaning places where they have decided they don't need to give anybody any notice or store people's belongings or do anything to offer someone somewhere better to be, is unconstitutional. And that is important and good, but that is not the end of the story. There is a trial in this case. It's starting in September. So more to come on that. If you've got other issues that you need to flag for us, please do. Tim, I just want to check in with you before we close. I know we're 7 minutes over now, so I think we want to tell people that we are not convening this meeting in August. Very unusual, but we are not having a general membership meeting in August, so we want to put the link for you to register for our September general membership meeting in the chat so that you do not let that creep up on you. We are still meeting the third Thursday. September is going to be super busy. By that point, it will be past the primary, obviously. We will be in full advocacy mode around city and county budgets. A little preview for you. We have a lot of work to do on both the Seattle and King County budgets. We anticipate a $60 million cut package, cuts to health and human services, will be sent from the King County Executive to the King County Council. So that is something we're going to need to push back on. And obviously we need to work on wages, inflation adjustment, and increased support, not flat support, because that's the only way that we're going to actually make a difference in our homelessness and affordable housing crises. Thank you. The Services Not Sweeps Coalition. I think we don't have time to do full justice to that, and I'm happy to talk with you, Kate. Thanks for putting that information in there. We definitely think that there's a lot of value to that approach, although I will say that our concerns are year-round concerns, as I know yours are as well. So thank you so much, everybody. Tim, can you grab the September general membership meeting registration?
I'm working on it, yeah.
Oh, thank you. Okay, great.
Yep, and
Wonderful.
I'll include it in the follow-up email.
Thank you so much. And you can always go to homelessinfo.org and sign up. Thank you so much, everybody, for the work that you are doing and for sticking with us in this cycle of education, advocacy, and services and action. We are really proud and honored to be in coalition with all of you. And thank you very much for being here with us today. Have a good rest of your day and week, everybody. Bye.
Everybody.
Mm.